Well, September is Suicide Awareness Month, and local doctors are now coming together to inform parents about the risks of marijuana use on youth mental health.
And for more on that, we want to go now to Fox 5's Alani Letang. She is live from City Heights for us this afternoon. Hi, Alani.
Good afternoon, Andrew, Maria. And the main thing that doctors want us to walk away with is that they're saying that the marijuana out there today is not like it was a decade or even a few years ago. Experts warn it's stronger and it's getting more young people hooked with the variety of options that are out there, concentrates, edibles, vapes. And because of that, they're saying they're now seeing a link between marijuana use and mental health.
Every day I treat patients who suffer from cannabis use disorder.
We want to make sure that parents and youth are making informed decisions and understand the risks.
Doctors laying out the relationship between marijuana use and youth mental health. They warn cannabis use is a suicide risk factor for people under the age of 25, adding that cannabis use disorder and daily cannabis use were associated with suicidal thoughts, plans, or attempts in people 18 to 35 years old with or without underlying major depression. The FDA is slapping on a warning for people with psychiatric history to avoid even prescription level THC.
People who have a mental illness can exacerbate their condition by using THC.
Experts warn that THC is also getting stronger. The Department of Justice found that the average potency level in marijuana has increased from 8.9% to 17.1% between 2008 to 2017. One parent taking notice of that for his oldest son.
It's often the start of a descent into a living hell.
The parent says his son got a pilot's license at 17, had academic goals, but quickly became addicted to vaping.
And then things got worse. He abandoned college after one semester, moved back home, smoked nonstop, alienated himself from his friends, spent all his money and much of ours, and became truly psychotic.
Doctors warn the high-potency THC out there is a risk factor for developing psychosis in youth.
And it can become permanent, even in young people who have no underlying mental illness.
Experts also advise not to shy away from substance use conversations, to instead have the discussion early and often with youth.
To be honest and open with your healthcare provider. If you do suspect use and your child is having a mental health issue, it's really important to have that conversation. Don't think that you're weird.
Our son is slowly getting better. Despite 9 months without weed and the same time working a full-time job.
Experts acknowledge that more research is needed out there to really better understand marijuana use and mental health, especially in youth. But they also warn that marijuana use can interfere with common mental health medication. So that's also something for parents and for youth out there to be aware of. Reporting live in City Heights, I'm Alani Letang, Fox 5 News.